Hello and welcome to another healthcare science session. This session we are lucky to be joined by Elise and Tom, who are trainee clinical scientists who specialise in respiratory and sleep sciences. So I'll pass you over to them and they'll explain all the learning outcomes and what to expect for today's session.
Perfect, thank you, Amy. My name's Tom. I am a respiratory and sleep scientist working in North London. It's in a hospital in North London. And I've also got my colleague Elise, who might introduce herself a little bit later. And so I'll do the first half of the presentation and then I'll pass over to my colleague for the second half. So what we're going to talk today about today is going to talk a little bit about respiratory and sleep science, what it's like as a career, and then a little bit about how you can get involved in the career, what the pathways are into it, and where to start. So, what are we going to cover today? So, first things first, what is a healthcare scientist? So, what does that involve on a larger scale? What are the different disciplines that we might see within that? And then more specifically, I'm going to talk a little bit about what is respiratory and sleep science, what that might look like day to day, what are the responsibilities that we undertake, and how that can be used, what can make a good respiratory and sleep scientist. And then Elise will talk a little bit about routes into the career, any career progression opportunities, and then where to start, most importantly. So what is a healthcare scientist? So healthcare scientists are at the backbone of diagnostics within the NHS. They work across a really wide range of different specialties to support with diagnosis, treatment and prevention of a huge range of different medical conditions. Really working at the forefront of science and technology. That's right. So there's over 50,000 healthcare scientists working within the NHS, underpinning 80% of all diagnoses. There's a really wide range of different specialties, over 50, that can be kind of organized into 4 distinct groups. So there's laboratory sciences with things like microbiology, physiological sciences, respiratory and sleep science, which we'll talk about in a bit more detail, medical physics and clinical engineering, so things like radiology and imaging, and then bioinformatics, which will be things like computer science. So there's a little bit of a stereotype that scientists are just people in white coats that sit in a lab and don't really speak to anyone, just look at a microscope. But there's a lot of different range in what we can do. You can work in labs, you can work in patient-facing roles. There's just a huge different variety. Next, please. So specifically, what is a respiratory and sleep scientist? So this is what me and Elise do, and it's specifically looking at a healthcare scientist that works specifically within looking at patients with breathing and sleep disorders. So this can include patients who come to us with chest pain, breathlessness and breathing difficulties, things like asthma and coughing, trouble getting to sleep, so insomnia, and breathing problems during sleep and other sleeping conditions. So there's a really large range of different conditions and symptoms that people will present to us with, and it's our job to perform different tests that can lead to an accurate diagnosis and allow for effective treatment of these conditions. So I'll mention a little bit about the diagnostic testing that we perform. And I've got a few different examples here. So this isn't an exhaustive list. It's just a few different examples I've picked out. So the diagnostic testing that we do allows us to get information that we can then use to get an accurate diagnosis of the patient, and they can get some treatment. So on the left, we've got lung function testing. So this will be performed on a little bit like the equipment you're seeing on the screen. And the patient will breathe in and out of the machine, do a few different kind of tests. And then me, as the respiratory and sleep scientist, will be coaching them through those tests, making sure that we're getting the most accurate results possible. So with a test such as lung function testing, it's really effort dependent. So there's a lot of patient involvement at getting the patient to do it right. They're quite difficult tests. That's what I really enjoy about it, is that there's a lot of interaction with the patients, um, building up patient rapport and making sure that we're getting the most accurate results for them. In the middle, we've got sleep studies. So either the patient will come into the hospital and stay overnight, or we'll send them home with some equipment that they wear while they sleep. And this will measure things such as their breathing, their heart rate, and their oxygen levels, and sometimes even their brain waves. And we can use that to diagnose different sleep-related conditions. So my job as a respiratory and sleep scientist will be to pop all this equipment on the patient, make sure it's all measuring okay. And then the morning after, I'll have a look at the data and be able to see if there are any trends in the data, anything that's indicating that there might be a disease present. On the right, we've got a bit more of a specialist test that only some hospitals might perform, which is exercise testing. So this will be done typically on something like a stationary bike, and it will be done to look at how the patient's lungs and how their heart responds to exercise and to a stressful situation. So I've talked a lot about diagnostic testing, but that's only part of what we do day to day. My favorite part of the role is how patient facing it is and how much interaction with patients we're able to do. And that ranges from things such as offering lifestyle advice, such as smoking cessation and exercise referrals, taking patient history, and supporting and advising patients through symptom management. So that might be teaching them how to use their inhaler properly. We also look at a lot of data and review the test data, write up the results, make sure that it's being sent to the right people so that the patients can get the most appropriate care. Thanks. So a little bit of a day in the life. So it might involve quite a lot of diagnostic tests. So that can involve some exercise testing, some sleep study testing, and some lung function testing. In between all this, there will also be reviewing data, such as from sleep studies or lung function data. And there will also be opportunities to work within multidisciplinary teams. So this refers to working with nurses, doctors, or physiotherapists to discuss a patient and decide what the best kind of route for their treatment and further testing might be. So why choose a career in respiratory and sleep? So obviously I'm quite biased because I really love this area of healthcare, but it's a really highly patient-facing role. So it's you get to build a really good rapport with patients. You're able to it's really rewarding because you're able to see the difference you made in a patient's life. And in some cases, you can kind of see the longitudinal trend that they're having, how they're getting better. And I think that's really rewarding. And it's really great to see. You can work both independently and as a team. So in my day to day, I'll spend a lot of time one-on-one with a patient, kind of working independently with them, but then also a lot of time as a team, discussing particular results, asking other people in my team for assistance. And that kind of combination of both independence and working as a team is really good. It makes me feel really supported, but also means that I have kind of free reign to kind of build that rapport with the patient. There's a really good work-life balance, and this area of healthcare is really good because it combines science, technology, and patient care all together. You really feel like you're at the forefront of kind of scientific innovation, and you're able to use that to really improve people's lives at the end of the day, which I think is really important. And finally, there's a really strong career progression. So right from when you enter the role until you're more experienced, there's a really strong defined career progression, which I also think is really good and really important. So what makes a good respiratory and sleep scientist? I mentioned it a lot already, but there's a lot of working with people, a lot of working with patients. So it's really important to be a friendly face, to have patience, because for a lot of people, it might be a potentially distressing situation. So by having patience and compassion and empathy, you're able to kind of provide this friendly face for someone. It's also good to have an interest in respiratory and sleep physiology, but I think in more of a general way, just having an interest in biology and how the human body works, I think is a really good place to start, and how you can kind of use scientific advances and technology to improve patient care.
Nice. So moving on to the sort of stuff that I'm going to talk about, which is sort of how you get into the job and everything like that. My name's Elise. I know I was introduced earlier, but like Tom said, we're both doing a program called the STP, which is something I'm going to talk about, but we're trainee clinical scientists. There are lots of different routes into the job, so I just thought I'd do an overview of some of them. I think one thing to take away is that everyone's journey in is slightly different. And just because you may find one route and you think, oh, that'll be perfect for me, doesn't always mean it ends up that way. So it's good to know your options, but also know that, you know, you can kind of fall into a job, and then if you like it, stick with it, and learn as much as you can. So just the type of different routes in. So there are traineeships, which are sort of education and training programs combined with work experience. So it gives you the skills and experience to help you find an apprenticeship or a job. So it's sort of getting into it. They range in duration, so some 6 weeks, some 6 months. I'd say they're really good things to try and get that work experience up. Having work experience is really good when you go for applying for other programs, and applying for jobs, and also it gives you an insight into, is this something I want to be doing and pursuing further. So you have traineeships, you then have apprenticeships, so you have higher level apprenticeships and degree apprenticeships. You also have an associate practitioner degree, so it's an entry-level foundation degree, which is 2 years, and then you top it up for another year to get that full bachelor's degree, and you get an entry via NHS Band 3 as sort of a support worker role. You then have a degree level qualification. Typically for those you need sort of 2 A levels, biology's required, and then your 5 GCSEs at 9 to 4, including that maths and English one. And then you have postgraduate entry routes, so you have to have a relevant undergraduate degree for those postgraduate ones. They can range, so I know people who did sports science who are now working, some people do biology, some people do medical science. As long as there is a relevant sort of undergraduate degree, you can make your way into those postgraduate roles. So course that me and Tom are doing at the moment, it's called the STP, which is a scientist training program. You then have the PTP, which is a practitioner training program, both 3 years, and they're fully funded. You work full time, and then you do sort of, where ours is a master's alongside your job, and then the PTP is a bachelor's degree. But you can also do masters in clinical physiology or cardiac science or respiratory science. Different universities around the country do those as well. So there's lots of different routes in. It's just about finding one that works for you. So a little bit more on the apprenticeships. So just on the left are different levels of apprenticeships, and what they're equivalent to. So those higher apprenticeships are your level 6, so your bachelor's or your master's. Like I said before, it's those 2 A levels or equivalent, so you can get them through your BTECs, and then obviously your GCSEs, maths and English grade 4 and above. They're typically 2 to 3 years, and then you earn, as you go, a band 3 to 4 NHS salary, and you work from day one. So it's quite a nice route in. You're getting hands-on experience as you go. You then have the degree apprenticeships, which are, you need your 3 A levels for. The band is 4 to 5 on the NHS salary. They're typically 3 to 4 years, and it's fully funded bachelor's degree. Then different training programs. So I know I briefly mentioned them. Like I said, the PTP is an undergraduate degree, so you get a bachelor's at the end of it. It's 50 weeks training in the NHS as part of the course, so that's really nice. You get that exposure and that experience. Program that me and Tom are doing is the STP. So I think our routes into it were slightly different. I did my undergraduate and then a master's. So I did an undergraduate in human biology and then a master's in sports medicine. Then got a job as a physiologist, as a respiratory and sleep physiologist, did that for 2 years and then started the STP. So I came in with maybe a little bit more hands-on experience compared to Tom, who did his undergrad and then went straight into the STP. So there's lots of different routes. Like I said, it's just about finding the one that works for you, but it's a fully funded master's, and it integrates that academic study with work-based training, so you get the mix of both. And at the end of it, you're a clinical scientist rather than a physiologist, and you get a professional registration, which is quite nice. I also did the postgrad diploma in respiratory science, which is a new program to try and get more respiratory and sleep physiologists working. So it is the equivalent of the PTP, so that 3-year program, but in 1 year. Again, it's fully funded, and there is a diploma in respiratory science and a sleep medicine one as well. So both are really good, both are quite competitive to get on, and you have to have a hospital that's going to fund you to get on those, but both are good. And then further down the training, or further down your career, there is a program called the Higher Specialist Scientist Training Program. That is a 5-year funded program, but you get a PhD at the end of it and you become a consultant scientist. So lots of different routes in, but I think one thing to take away if you want a career in healthcare is that there's always opportunities for progression. There's always opportunities for training. You just have to find those programs, but they want you to learn. They want us to become better healthcare scientists. So yeah, it's nice to know that throughout your career, even as you get more and more experience, there's always opportunities to progress further, and improve your knowledge. So those are all things that I liked. So I know that was quite a lot of information, but there are lots of different routes. So just a quick summary. You can do an undergraduate in a healthcare science or in a physiological science or an equivalent one, and then specialise and apply for NH jobs once you finish that. There are degree apprenticeships that you can do, so specialise in respiratory and sleep in particular, or any healthcare science really. You typically need sort of 96 to 120 UCAS points, which can be made up with your A-levels or your BTECs and those 4 GCSEs, including that maths and science. Or you can do a relevant degree and then apply for further training programs, and you typically need a 2-1 or a 2-2 to apply for that route. So yeah, just a little summary of the different routes in that you can take. But like I said, everyone's will be slightly different and slightly varied. So if you have a plan and it doesn't quite go to plan, don't worry, there are lots of other routes that you can take into it. So like Tom said, there is good career progression in this route. You can also join as a band 2 or a band 3. We just didn't have room on the slides to put it. So when I started my career, I started as a band 3 trainee respiratory physiologist. So lower than a band 4, but I got the exposure I needed. I got the training, and then I moved up to a band 4, then a band 5, and now I'm a band 6. You can sort of skip bands as well. So for Tom, he came in at the STP entry point, so he came in as a band 6. But it just shows you there's clear steps, and that's one thing I like about it. I know what I need to get to the next banding, and what that job will look like, and it's nice to know, you know, that there is that progression. So your band 8 are the people who run the departments, and then you've got your band 8D to 8C. Those are your consultant clinical scientists, the ones that have done that program, and you just work your way up. In terms of salary expectations, so that is all banded as well. So when you get the job, there is a entry, a mid, and then a high level point. When you work in the NHS, every 2 years within a band, you get a pay bump up to the next level. And then if you live in London, So if you're inner London, you get an additional 20% on the basic salary. So the ones on the screen are national, so it'd be an extra 20% on that. So if you're looking at your band 5 in inner London, your salary bracket is 38,000 to about 46,000 for your band 5. Again, if you're in outer London, that's 15% on the salaries that are on the screen, and then if you're on the fringe, there's a 5%. So it's good to know that they're, you know, well-paying jobs, which is nice. Couple of things about why working for the NHS is good. Competitive pay and the NHS agenda for change. There's a pay scale, like I've shown you, but they update it, which is nice. Job security. NHS employment is good and you have good employment rights, and leading into that you have a good pension as well. So it's one of the best pension schemes in the UK, and the employer contributes to that significantly, which is good. There is lots of wellbeing support, so whether that be mental health, you get gym discounts, there's initiatives to cycle to work, and wellbeing of your colleagues as well. I think everyone in the NHS to each other is quite friendly, which is nice. Like I also said, there's paid training and professional development, which you don't always get in careers, which is nice. They develop courses, they can pay for them, you can go to conferences. So I know those are all things that me and Tom have been able to experience, which are good. It's good for networking, it's good for meeting other people, doing the job that you enjoy. And the annual leave is pretty good too. So 27 to 33 days holiday, plus your bank holidays. And as you increase your service length, you get additional days for your annual leave, which is also nice. So a little bit about where to start right now. Obviously, it's dependent on your age, but get your GCSEs, of those 4 GCSEs. Make sure you have a science in there and your English and math. Choose your A-levels or equivalent, whether that be apprenticeships or BTECs. For going into, I would say, a healthcare science route in general, biology is quite key. And then BTEC and applied sciences are also accepted by many universities. Big thing is about getting work experience, whether you can get any experience within hospitals or volunteering or St. John's ambulances or any health organisations. That looks good when on your applications. It shows that you're interested in it, and I think it's also good for yourselves to get experience of this if this is something that you'd like. There's also NHS career website and UCAS for healthcare science courses, so you can look into those. And contact your local NHS trust, because there are people that will help, and you might be lucky enough to get on a work experience, even if it is for a day or a morning or something like that. So those are just sort of things you can do at the moment. This is a link to some of the information on work experience and how to do that. And then on these slides is just a bit more information about our jobs, and sort of guidelines that we work towards. So ARTP is a big one for all of our respiratory stuff. It tells us how to interpret results, it tells us how we should perform the tests, and it's good to know that you have a guideline to look at. Then you have BSS for sleep, and then Academy for Healthcare Sciences have a range of resources as well. So yeah, just a couple of useful links if you want to check on those later, and we can send the links if you need to. And then these are just a couple of degree options that I found, and information on apprenticeships and different job applications. So yeah, look at all the routes and just see one that works for you, or try lots of different ones, because you never know where you'll land. Does anyone have any questions?
Lovely. Thank you so much, Elise and Tom. That was a wonderful presentation, really kind of giving it a nice overview on what it is you guys do. If you do have any questions, just please pop it in the chat. I might start it off if that's okay.
Yeah.
So what made you kind of take that step into respiratory and sleep?
I can answer it first if you want, Tom.
Yeah.
So I knew going into uni that I wanted to do something that I was interested in. Because I think if you're going to be studying something, it's good to be interested in it. So for me, I always loved sport, and I was always interested in how the body worked. So that sort of started the route off. And then when I finished uni, I didn't know exactly what route I wanted to go into, whether it would be like sports teams or healthcare. So I applied for lots of different jobs. I did some cardiac, I did respiratory ones and sleep ones. I'd say I sort of fell into the respiratory one. It's the job that I got, but once I was there, I fell in love with it. It's so important, respiratory, and how your body works. It's breathing. We all need that for life. So I think I found that really interesting, and I love the patient interaction side of it. I know that Tom said that earlier, but it's quite a unique field in that you interact with the patients. You have to really give your all for them to get the best results. And if you're not interacting with them and giving them your energy, those results are going to be subpar, which can affect sort of their treatment. So it gives you a lot of, you get a lot out of it. And I would say from the sleep side of things, that's really good as well, because we treat a lot of people that have something called obstructive sleep apnea, which is where your airways sort of collapse under themselves, and we give them a treatment of a CPAP machine, which is what they wear when they're asleep. And you have these people that come into clinics and they look really tired and they're not sleeping, and they say that they're, it's affecting their life in every way. They're falling asleep all the time and they're unhappy. And then you give them a treatment and then they come back in and you can visibly see they're brighter, and they say, "You've changed my life, and this has made my life so much better." And it's a really rewarding job from that side of things. And I think the level of interaction that you get with patients in respiratory and sleep is really good. And I find it really interesting. It's all related to breathing, which is fundamental. So yeah, that's what drew me to it.
Lovely. And what about you, Tom?
Sorry, could you repeat the question just so I...
What made you get into respiratory and sleep?
Yeah, so I think quite similar to Elise. I did sports science at university. I was very interested in kind of biology and human biology. Straight after university, I heard of the scientist training program, but then I did a master's, and I think that kind of cemented my interest in respiratory as a science. But I think I found out a little bit more about the STP and about respiratory and sleep science. I think finding out that it was a really patient-facing role again, as Elise said, I think really drew me into it. And that's why I kind of applied to it. And now that I'm in it, it is really patient-facing and it is really rewarding. And it does kind of utilize the science that I'm interested in. So yeah, I'd say I fell into it because it was kind of something I was interested in science-wise and all the way from school in terms of biology. And then being able to kind of tie in the kind of patient-facing, being able to meet and talk to different people every day, I think made me realise that was kind of a perfect choice for me.
And looking back at work experience, did you guys have any work experience in a health or health related field before you started?
Do you want to go?
Oh, sorry. Yeah, I actually didn't, to be honest with you. I think I was quite lucky applying to the scientist training program without any significant work experience. I did do some shadowing with different doctors, like some respiratory and sleep doctors, as part of my university study. So that was something that I kind of sought out different lecturers and professors outside of lecture time to see if they would have me just to watch clinics and stuff like that. But in terms of actually working in a healthcare setting, no, I didn't actually have any work experience. But I think by reaching out, it definitely kind of increased my interest in the area, and also it shows to other people that and to places that you're applying to that you are interested in the area and you're willing to kind of go out of your way to to get exposed to different to the area and to the different things that you see.
And then for me, I had some work experience whilst I was uni. I worked with this charity called Action After Stroke, and it was about rehabbing people who had strokes. So whilst not in a healthcare setting, it sort of gave me that exposure of working with patients or with people that weren't technically patients, but working and using science and what you'd learn to sort of rehab them and get them to the best place that they could be. And then I did some work experience with sort of St. John ambulances and doing little courses here and there. But no, none officially in a hospital or a healthcare setting. But I definitely think that would have been useful for applications, and it helps you stand out. So if I could go back, that's something that I would do.
Yeah, I think it's interesting that you both came at it from different places, but even with your work experience, it can come from anywhere really. It doesn't have to be that you're in a hospital, because oftentimes it can be tricky to get work experience in a hospital. It's not impossible, but it can be tricky, especially if you're on the younger side. But there are different ways in. For example, different hospitals might have training and education leads that you might be able to contact to then get through some work experience or shadowing there, or contacting departments directly. So I guess for me, it's kind of showing that don't be discouraged if you don't get the work shadowing or experience that you particularly want, because any kind of route can get you where you want to be. Sometimes you do have to be a bit persistent with the emails, but it is possible. You just keep trying. Wherever you can get any experience is good, really, and just showing that you have an interest.
Yeah, I think so. And I think if you have enthusiasm for something, when people are reading applications, that does come through, and getting any experience you can, like you said, is always helpful. But if you're genuinely interested in something, I think that comes through when you apply for things. So it's tricky, and I know it's cliche, but I think if you find something that you are interested in, that does come through when you apply for things as well.
Yeah. Again, please feel free to put any questions you have. Otherwise, I'll keep going. And I know you kind of mentioned it before, so kind of that patient facing is what you enjoy about your role. So what's the thing you enjoy most about your specialism, about respiratory and sleep?
I would say that the fact that it's sort of two specialties in one. I think it can vary depending on where you are in the country and what hospital you're based in. So some are just respiratory departments and some are sleep. I'd say I've been fortunate enough that where I've worked is both. So you get to experience sort of two specialties in one. I think it's really interesting, and your learning is then far greater, and you get exposure to lots of different things. I'd say my favourite thing about interacting with patients and working with patients is because that what you do impacts the results that they might get, but also the ability to interpret those and then help with the pathway. So, I mean, healthcare scientists, we work from the diagnostic side of things, but it doesn't mean that you're not then helping them in the long run and with the treatment. I think a stat was released last year that healthcare scientists and sort of physiologists work for diagnosing 80% of patients who are diagnosed in the NHS, like with all the tests that we do. So it is really important stuff, and it is really essential for pathways and for treating conditions. So I think knowing that and being able to interpret the data and give results is something that I really enjoy.
I think I'd say for me, especially within the sleep kind of side of things, is being able to see patients along kind of like their whole journey. So being able to see them come in for a diagnostic test, and then reviewing that test, giving them some treatment options, and then reviewing those treatment options. I think it's really rewarding and encouraging to see when it works. And then with something as important as sleep, when their sleep starts to get better, it like really does change their whole life. So I think it's really encouraging and great to see when you get someone come in for kind of like a review appointment, and they just say that like their whole life has changed since being on a particular treatment. I just think that's like really great to see. And the fact that I can kind of see that multiple times a day, I think is really good. And I don't think it's ever something I'd take for granted. So I think that's what I like best about my job.
Yeah. Thank you. Well, if there aren't any more questions, thank you both for your time, and thank you for attending. And we'll be putting this up on YouTube. If you have any questions later on, you can pop your questions in through on Springpod, and then one of the ambassadors can get back to you with any answers if you have any questions. Well, thank you, and have a lovely rest of your afternoon.
Thank you.
Thank you.
Bye.